Well, good afternoon. It's a pleasure to be here, and Sharon and I sincerely thank the Arthritis Society, Deb and Tamara, for inviting us to speak about a topic that's really near and dear to our heart, lifestyle choices that impact arthritis pain. Oh, good. Now, would you believe that there are lifestyle choices that you can make that can help your arthritis pain and even give you strength and endurance? Well, there are lifestyle choices, and that includes joint protection and exercise. So arthritis, as we know, is a very difficult chronic condition, but what you do or what you don't do can have a major effect on the level of your arthritis pain that you experience. And it's totally possible to learn a few self-management strategies to help with your pain, gain control over this chronic condition, and realize a lot of hope for the future. So today what we're going to discuss, Sharon will discuss how joint protection principles work. I'm going to talk a little bit more about understanding the role of exercise. And most importantly, we're going to try to give you lots of options on how to implement this in your everyday life. And for many Canadians, arthritis affects their ability to move, to work, to get a good night's sleep, and it causes a lot of pain and suffering. How many people, I think we've heard this a few times today, a lot of people are affected with arthritis. It accounts for 1/3 of chronic disability in Canada. 6 million Canadians have arthritis, 1 out of every 5 presently. Now, we know in Canada, the future of Canada is aging. And as the baby boomers age, about 1 out of every 4 Canadians will have arthritis by 2035, and that's an extra 2.5 million people. The story of arthritis can really be told through the tale of my 2 friends. And I sincerely thank these 2 ladies for letting me share their stories with you. I did get their permission. And really, they are my heroes. The lady on the left, her name is Lori. She's a lifelong friend of mine, grew up going to kindergarten together, and at about age 10, grade 5, she was diagnosed with juvenile rheumatoid arthritis. And she was a person who always loved sports, but could never play sports. She always had to be the team manager. And now, living in Calgary, she's an active mom, and how she implements exercise in her life is she uses it during her commute. When she walks her young son every day to school, okay? How she uses joint protection in her life is she makes sure she gets good activity balance and she gets good rest every night. The lady on the right, her name is Andrea, the lovely Andrea. She's an exercise therapist where Sharon and I both work, Kinetic, on the 8th floor of City Hospital. And Andrea was an elite athlete growing up. She was a competitive gymnast. She had track scholarships to the United States. And as a pole vaulter, she sustained several joint injuries. And at the very young age of 37 presently, she's already contemplating a number of orthopedic surgeries to help manage her arthritis. And how she implements exercise in her life is she schedules it every lunch hour. She's out rain or shine exercising at lunch. And how she uses joint protection is she has to wear a knee brace, which offloads a lot of joint pressure on her knee. So we thank her, Andrea and Lori, for sharing their stories with us. So here's an amazing quote by a person with arthritis that really stayed with me. The common perception is that arthritis is an old person's disease, and there's nothing you can do about it but suck it up. Well, that is just not true. It's not true in a couple of different ways. Mainly, it affects all age groups, and there's lots you can do. So in arthritis, there's some things we can't affect. We can't affect aging, unfortunately. Genetics, gender, we know it affects more females. But there are a lot of risk factors that we can affect. And that includes trying to have a healthy body weight, avoiding obesity and overweight, trying to be physically active. We want to always work towards prevention of joint injuries through joint protection. Smoking is definitely related to certain types of rheumatic conditions, and I think it also affects your circulation to your periphery. And finally, stress, I think, overall increases severity of symptoms. So now I'm going to call upon Sharon, and she's going to talk about the role of occupational therapy as well as joint protection.
As a quick show of hands here before I get started into this too much, besides meeting me out there this morning, how many people have had previous contact or referrals to occupational therapists? So there's actually a few in the room, which is really great to see. As an OT and being trained in this profession, we have specialized knowledge and skills that create an ability for us to be able to adapt or modify environments to try to improve people's overall independence as much as possible so they can still engage in all the things that they want to do and all the things that they need to do on a daily basis. So what is this joint protection stuff all about? When we're educating clients about joint protection, it's really about self-management. It's something you have to take control of. It's not something that somebody can be telling you to do every day. You have to be the one that's in the driver's seat once you're given the information that you need and able to be incorporated into your daily routine. I'm just going to go back one. It's also about really using your joints wisely. How do you do the things that you do every day, not to aggravate your joints, not to strain the joints, not to cause increases in pain? So being informed in terms of knowing this activity is probably going to be something that I'm going to have to look at. I'm going to have to adjust it. I'm going to have to modify how I do it so I don't deal with repercussions after the fact in terms of having increased pain, fatigue, those types of things. So joint protection, what's it all about? It aims at maintaining your functional abilities through improving both the way you do the work and the movement that it's associated with. It's also looking at assistive devices. I don't know, I'm assuming most of you stopped at the kinetic table out there, but we had lots of examples out there of different kinds of assistive devices that you can use to unload some of your joints, to improve your abilities to be able to do your daily routine. It's also about pacing your activities. We've heard lots of people talk about that today. Looking at your rest, looking at how you're structuring your day. And that could mean different things to different people in terms of where you feel like you have the most energy, where you feel like you have the least pain, what kinds of jobs are you going to take on at that time of the day. It's really important to keep moving and keep doing things. If you're not doing those things and you're having other people substitute or fill in for doing them, you lose your own autonomy, you lose your own independence. And so being able to complete those tasks on your own will stand you well in terms of maintaining strength over time. There are excellent resources out there. You don't have to reinvent the wheel yourself. The Arthritis Society itself has a great booklet in terms of managing lifestyle issues. There are also lots of great links and tools on Canadian Association of Occupational Therapy websites, the American Association of Occupational Therapy websites as well, that speak a lot about joint protection and energy conservation. As I said before, you have the most important part to play in all of this. Looking at things like, are you taking your medication regularly? What kind of response do you get from that? Are you getting what you think you should be from your medication? If not, making sure that you talk about any of those changes with your therapist, your family practitioner, your rheumatologist, whoever it happens to be. And also taking control in terms of protecting your joints from stress. This is a quote from our exercise therapist at work. It was interesting to read this, and she felt very, very passionate about saying these things, that she was very overwhelmed when she was told she had osteoarthritis in her knees at the young age of 34. She tried to focus on the things that she's still able to do and not on what my limitations are. It has given her the opportunity to explore new activities that don't aggravate her knee, taking care of your mental well-being and remaining active, controlling the things you can, and remaining positive. As an occupational therapist, we're very fortunate. We get trained in both physical medicine and mental health. You can't tease the two things apart. One impacts the other. And so it's really important to look at all those things and how your own mental attitude and your support systems and all those things play into your own abilities. Protecting your joints it's incredibly important to do. So there are lots of features associated with joint protection, helping prevent joint inflammation, decreasing pain and swelling of an inflamed joint, helping prevent damage or deformities in the unstable joints by placing too much strain and stress, and decreasing the amount of wear and tear, especially minimizing excessive forces through the affected joints. That's part of the reason why, as occupational therapists, we'll often recommend different types of aids to daily living tasks, because by using those, you unload some of the joints and decrease the amount of stress and strain on the joints. The other thing that we look at, are there splints involved? I saw several people here today with silver ring splints on. Those types of things that protect the straining of the small joints of the fingers are really important so that you can do the activities and not incur as much pain as you go about your day. Really important to look at seeking that balance between activity and rest. Don't wait until you're dog tired when you're engaged in an activity. Try to plan your activity so you can take a break if you're starting to feel tired. Avoid standing in one posture or being in one posture for long periods of time. Sometimes taking that little break, even if it's only for 5 or 10 minutes, will give you that kind of regrouping and that energy you need to be able to complete the task. Things like changing positions frequently. We're not setting a great example today. We've all been sitting way too long. But things like, if you had the whole family over for Christmas supper and you don't have a dishwasher and you're going to wash all those dishes, how can you do that that's going to unload your joints a little bit? Maybe using a stool at the kitchen sink, maybe doing it in batches. I'm going to do this much now, I'm going to do these kinds of things later. So again, you're breaking up the task. How to use joint protection and respect pain. That's the key. Stop your activities before you reach the point of pain. Limit your activities from causing pain. If you're having pain after a specific activity for more than 2 hours after you've completed the task, it's too much. So look at, what could I do to modify that might decrease my pain? How could I pace this differently? Would this be better done at a different time of day? Would I be able to do it with less discomfort? Pacing helps to minimize the symptoms. So do little bits of things more frequently during the day as opposed to trying to, I'm going to get the whole house clean this morning kind of mentality. Taking regular breaks, changing your position, stretching, which Monique will talk about a little bit more, and mixing heavy and light jobs. Do the harder, more fatiguing jobs when you're feeling most refreshed. I'm a morning person. That's my best time of day. Anywhere from 5 a.m. till 10 a.m., I'm great. Ask me to do something after 9 o'clock at night, not so great. So if I'm looking at my own activity level, I choose those times that are going to work right for me. And that might not be the same time as it is for your spouse or your children or whatever it happens to be. But it has to be right for you, not for anybody else. Prioritize your activities. So consider the activity time and the difficulty. Plan activities for peak energy time, like we've already been talking about. It might mean reorganizing things and planning your day differently. Avoiding activities that can't be stopped. If you're going to clean the oven or something like that, and you know you want to get it started from, or you want to do it from start to finish, how are you going to do that? And is that realistic in terms of your current symptoms? Can adaptive equipment help? Yes, it definitely can. So lifting and twisting equal joint strain. When you think about a lot of the little objects we use every day, things like water bottles, how hard that is some days if your joints in your hands are really, really stiff. Fingernail clippers, again, something that places a lot of stress and strain on the tips or the little joints in your fingers. So are there things out there that can improve your pain? And also protect the joints that have become unstable or weaker over time as well is really important to do. So this picture here of a thumb splint to support the base of the thumb. Lots of people with arthritis, as we age, there's a joint at the very base of the thumb that starts to wear out. And as you start to load that up, it'll cause pain and it will decrease the amount of time that you can spend on an activity. But if you can do something to support that, then you can decrease the amount of pain and enable you to do the activity. Things like long handle reachers, if you have problems with your hips or your knees. Again, something that will again improve your independence and not having to ask for assistance and enable you to keep moving and keep that strength required. Making sure your joints are placed in good alignment. So before everybody thinks about their posture, look at how you're sitting right now, okay? Then think if I put a string right at the top of your forehead and I went to pull your body up, what would happen? Your shoulders would go back, your chest would come up, your head would be more in midline. But as we get tired during the day, that's one of the things that we let go is our posture, and that can really influence how much pain we have. The other thing about standing for prolonged periods of time, look at your footwear too. Oftentimes we're expecting very poorly supportive shoes to be assisting us during our daily routine. But look at how that affects our overall pain in our lower extremities, in our back, and our abilities to be able to go for walks and stand. Same thing with sitting postures. Remember that kind of more upright posture in terms of the shoulders back and sitting nice and upright. When you go to stand up from a chair too, come to the front of the chair. Use armrests if you have them to help to sit up, to stand up into upright posture. So using your body effectively to do. Whenever you're going to be doing a lot of physical activity at home, or if you're going out for walks, remember to do a warm-up, something that's going to get the blood flowing, your muscles kind of get used to the idea that you're going to be asking it to do more. Use the larger, stronger joints, and we have a few pictures coming up too in terms of why that's important and why it's important to use the ones that are stable and strong as opposed to the smaller ones or the more unstable joints. So things like how to protect individual joints. Minimizing strain on your fingers or wrists. When you look at a lot of women's purses, not trying to be kind of sexist here, but the reality is a lot of us have way too much junk in our purses. When you think about these small little finger joints and what you're asking them to do if you have arthritis, if you're holding it by your hand, get something with a nice long strap. You can put it over your shoulder and you're not having to cause yourself that excess pain. In the kitchen, things like lifting a heavy pot. Use two hands to do that as opposed to using one hand to support all that weight. Put your oven mitts on, put one hand underneath the pot, one hand on the handle, and then at least you're distributing the forces and the loads over a larger surface area so you're not causing so much small problems on a smaller area. Minimizing your hip and knee strain and pain. Closing lower drawers on cabinets. Use your hip and knees. Opening big, heavy doors, and so many buildings have these. Using your hip and your upper body to do that, as opposed to using your hands to open the doors. Setting up your home. The objects that you use most commonly in your workshops, in your kitchens, whatever it happens to be, should be stored between kind of hip and shoulder level. If you're storing heavy pots and pans really low or really high, that's placing a lot more load on the joints. So try to reevaluate how you have things organized. Look at those things that you're using all the time. Try to have them within easy access and reach. There are also excellent resources on this, on the Arthritis Society, and again on occupational therapy web pages in terms of just overall home setup and design. The last thing in your workplace, look at the ergonomics of how your workplace is set up. Are you in good alignment? If you're somebody who's a computer user, are you in good alignment with your screen? Is your chair providing you good support? Those types of things. If they're not, if you're using things like a laptop, think of how your posture is when you're doing those types of things. You're often very forward flexed, it's not very good alignment, you don't have your arms and hands in good alignment either. So look at how your whole workstation is set up. Again, there's lots of room for ergonomic assessments and having people kind of take a look at it from an outsider's viewpoint and being able to give you some advice and feedback in terms of how to make that a better and more comfortable work environment for you, and again for decreasing your pain and strain associated with those prolonged joint stresses. I'm going to hand it over to Monique again.
So Trevor just did a fantastic job this morning about why we should use exercise for arthritis. So I'm going to just try to focus a little bit more on how to incorporate that in our everyday life. So we know it's the mainstay of conservative care for arthritis, and it helps reduce pain and increase function. It also really realizes when you have a loss of motion, it will also affect your function. How does exercise help? I love the saying, motion is lotion. So you can see all those benefits. We know that it really also helps strengthen bone, bone and cartilage, which really depends on lubrication. and overall it helps reduce joint pain. It is clear and proven now that research shows exercise helps both rheumatoid and arthritic pain. It helps reduce muscle loss, and it also helps reduce body weight, which overall helps function. So here's an overall summary of the benefits of exercise and arthritis. And we know it helps pain. It gives a person an ounce of control, self-management. It helps your strength and stamina. And I think when you get a good workout in during your day, you're going to sleep better at night. As well, it can be done pre or post-surgery. So let's say someone may be coming up towards a knee replacement. It's like money in the bank, the stronger you can get your thigh muscle. There's also lots of mental health and social benefits, because oftentimes when you're exercising, it gets you out of the house. Now, activity balance is a must. The old advice was no pain, no gain, kind of muscle man mentality. That is wrong. Instead, I love this Saskatchewan Physiotherapy Association saying, no pain, all gain, or at least manageable pain, all gain. A little bit of joint pain after we exercise is reasonable, but if you have long-lasting pain, inflammation, swelling, joint redness, more than 1 to 2 hours after you've quit the activity, you definitely need to manage that pain and then readjust both your frequency and your intensity of exercise. Again, I won't spend too much time on this because Trevor did a fantastic job this morning, but we're going to look at flexibility, range of motion, strength, and that could be body weight, TheraBand, free weights, cardiovascular fitness, and neuromotor, which basically means looking at alignment and balance. All those components make up a strong program for arthritis exercise. First steps to exercise, you may need to consider medical clearance if you have other serious premorbid conditions, other health conditions, and that would include cardiovascular problems, if you've had serious diabetes, high blood pressure, problems with your lungs, or problems with spinal pathology. You may need to make sure it's okay for you to exercise. And you may also want to consider an individualized assessment by a physiotherapist or other healthcare practitioner. So how do I start exercising? If I was assessing someone as a physio, I would look at their posture. I would look at where are they having problems with specific joint loading. Do they have a range of motion restriction? Do they have a muscle imbalance where they're super tight and strong on one side of their joint, and on the other side of their joint, they're weak and elongated? I'd also look at activities of daily living, such as balance. How are they doing stairs? How are they walking? Now, if I had arthritis and I had pain, this would be a very reasonable question to ask. How can I exercise when it hurts? And I think a lot of people have the preconceived notion that in order for exercise to be helpful, they have to do a whole lot of it. Well, that is simply not true. And in fact, you should, if you're just starting out, start very slowly. 5 minutes, even once or twice a week, is exactly what you should be doing. So once you have some benefits from starting very slowly, then you can gradually progress. You definitely want to address the areas that are a concern to you, and the goal would be to make a tailor-made exercise program. Other tips to protect your joints: make sure you keep the impact low. You may want to consider heat before you exercise. Move gently, be sure that there's a warm-up component. You may want to ice afterwards, even putting a bag of frozen vegetables in a pillowcase, putting that over your affected joint. And go slowly, trust yourself, and enjoy. Now, life is busy, and I like this slide because it talks about sneaky ways to implement exercise into your life. The first way is commuting, and that would include, if you're close enough, walk or ride your bike to work. The second way is take regular stretch breaks. And I sometimes ask people to have a timer on their watch every hour. Even if you stand up and take yourself out of that forward head position is very helpful. Schedule exercise, just like our friend Andrea, who we work with. Every lunch hour, she schedules it in, just like every other appointment. And make it social. I have seen a lot of people at the mall doing their mall walk, and then they stop for coffee at the end. That's really awesome. There's excellent resources. The Arthritis Society has a fantastic Flourish segment, which is very good. Arthritis Research Canada, also excellent. Begin slowly, progress gradually, and try to avoid activities that cause a lot of joint strain or joint loading. You definitely want to adhere to that 2-hour rule, where if you're having big pain lasting for hours after you've quit exercise, please readjust. Be sure you always respect pain. If you're going to be trying a class, that's fantastic. Just make sure that you monitor how you're doing and it's appropriate for your age and abilities. And why wouldn't you just ask the instructor, I have arthritis, how could I modify? That's a very good idea. Have fun and stick with it. There are endless opportunities and possibilities for exercise. A few of my favorites are walking, very inexpensive, pool therapy, I'm going to talk about that in a moment. Home programs, some people like to exercise in the comfort of their own home. Other people like to go out to all the amazing facilities we have here in Saskatoon, the Field House, for example. Gentle yoga, Tai Chi is fantastic for balance, and there's lots of options for bikes. A recumbent bike where your back is supported, and arm bikes where you don't even have to use your legs. You can still get your heart and lungs going, and it's great for people with hip and knee osteoarthritis. As I mentioned, pool therapy is an excellent option. Sharon and I are fortunate enough to work at Saskatoon City Hospital, which has a very beautiful therapeutic pool. I was just in it yesterday teaching a class, and I checked the thermometer, 92 Fahrenheit, 33 Celsius I saw. So when I walk into the pool, everybody goes, ah, because it feels like we're walking into Mexico or something. And when you're in the water, it's just the best choice for osteoarthritic joints. The buoyancy of the water really allows you to move freer. It feels fantastic. Our pool is set up with a ramp with handrails on either side, and it's just a fantastic resource. We are looking at trying to develop more exercise therapy and pool therapy classes, so if you're interested, please let us know. Activity balance is essential, and be sure to monitor for joint irritability. And joint irritability means those active signs of our swelling, pain, heat. Don't ignore those. No matter what your exercise experience, it is never too late to start. I recently started a woman, I think she was in her mid-90s, on a program, and she loves it. So our take-home messages today: exercise helps arthritis pain. There's a real role for joint protection strategies to help self-manage. There's a lot of hope for the future. Pain relief is definitely within reach. Thank you. Our facility. This is.
My question was, if you want to come to your facility at the City Hospital, do you have to be referred, or is it free to the public, or do you have to see an occupational therapist there?
Our facility is a private clinic, and it is fee-for-service, so you do have to pay. Physical therapy, occupational therapy in Saskatchewan is direct access, so you can self-refer. So if the therapist has any questions, we definitely have a very good working relationship with the family physician. And if we have any questions, we would be phoning the physician and really having good exchange of information there with the person's consent.
The one thing I just quickly add to, if you were going to draw on an insurance benefit, sometimes in order to pay for your therapy services, sometimes the insurer wants a physician script. We don't necessarily need it, but sometimes in order for you to get reimbursed, you need it, so, okay?
So what's the difference between physiotherapy and occupational therapy?
Okay, that's a good question. I can speak to the physio part. The physio part really focuses on the body part. Like, for example, someone has an injury. I'd be looking at the component parts, the range of motion, the strength, the endurance. And there's tons of overlap. And I don't want to take words out of Sharon's mouth, but occupational therapy works a lot on function and how people are doing with everyday types of things. Take it away, Sharon.
Yes, occupational therapists in general, we look at all the activities that would be incorporated in your regular day. So your home, your work, your play, your leisure, all those things, and looking how to maximize your independence based on whatever is going on with you. We also integrate the mental health and the physical components of things to try to make life the best it can be.